is our goal after wax trying. We're going to make the small diastema of the patient's request after that. Patients from our YouTube site, so they want the best as possible. Side view, I need a diastema. You see that area?
Yes.
That's okay, bring it in. 8 and 9 first, yes. Make shorter, no problem. So I have to try in. Entire facial, you can bring it in, is okay. Entire, sorry.
Okay.
Entire. Right, that's right. Perfect. Okay. Yes. And make shorter, it's okay. Right? But I need a lingual retention, as you know. Right? Keep cutting. Keep cutting. Because chrome cobalt, metallic ceramic, has a really huge oxide from inside. So I have to cut the fascia at least 3-4 millimeter thickness. That's right. And then gum tissue, bring down too. That was wax, so don't worry about it. Yep. Cut down. I like that. Hold down. Flat, make flat. Yes, I like this. Perfect. So once you set up 8 and 9, okay, exactly the same. 9 2. And then go to lateral. When you see the occlusion view alignment, you see the out, so bring it in. That area, canine, lateral down, canine down. Right. Okay, this. Down. Okay. Talking about the here, everything bring it in. Because we bring it in, premolar, yes, yes. And shoulder. Yep. That's good. Let me see the other side. Same thing, this side too. Tissue from tissue, cut it. Down. Yep. Shoulder. Way shorter. Yep. Okay. Now here's tissue. Push it. Everything push down all the way back. All the way back. Okay. Now the other side. Here looks good. The other side tissue. I think here is down. Yep, it's pretty good. I like that. Our occlusions make the U shape from the occlusion content. Compared to this canine to lateral, so this is too high. Down. Okay, perfect. Let's go to the other side. Same thing, everything. All the way back. Here, especially down. Yeah, usually. Good. Cool. That's good. Just a little bit bring in here. Everything's good. So I'm going to add with the underneath planning with the porcelain. That's good. Alright, good to go. This is our goal after wax trying. So we're going to make the small diastema of the patient's request after that. And then here's this bulkiness. We're trying to decrease facially, which is we did already quite a bit from here. Okay, and also patient requested trying to delete it pink as possible. But the problem is whenever I saw the patient's maximum smile, okay, Okay, so I see that one, but I have to cover with a certain area. So what I'm going to do, I'm going to make a little bit. Decrease inside the edge. And then increase it about the tissue. That's much better. So that means I can decrease more tissue. Okay, so that's my goal. Now my frame will go into that kind of direction. So what I'm going to do, I'm going to make a little bit more longer. Okay, so then I can decrease a little bit, decrease it more longer. So then get minimum pink aesthetic from these long, big span cases. That's the plan goal. So whenever I mounted the case from here, side view, see, that one is the patient's smile they can get. I'm trying to make the edges possible, both inside the edge area. I'm trying to decrease the facial darkness, which is I did already. Maybe other side. This is patients from our YouTube side, so they want the best as possible. So we're trying to deliver him as much as possible, which is just world class aesthetic for sure. Okay, that's the frame goal. Open the panic. We go to King Porcelain. Now this is a framework. We made a diastema between the tooths, trying to make the top of the line case this patient as much as possible. Here is the pre-op. We saw the oral design. Now ready to build up. For the metal, porcelain fused metal here, which is high fusing at the upper zirconia micro layer. Another great case going on. Now is the final after cementations with the case. So we are achieving for the highest aesthetic as possible. And this gentleman wants the between the teeth is open, so which is we did it exactly the facials with lines of diastema. More natural lifelike restoration. Alright, so that's fully contact, so which is a great choice for this gentleman. And then occlusion forces only anterior, there's no posterior teeth except this, right? So that's why it has the high retentive. The occlusion will not get much cracking and chip. Any failure. See, looks like individual tools. All this. Whenever you're going to see my cementations, I made so many cementation video previously in my YouTube channel, so you can take a look at it. That's why I skip it. You see, that one is eventually the stop line, so probably they have to replace in the future. Now, when he has the money and he needs, I recommend is flex partial in between the teeth, because he needs some support here to get the occlusion contact but better chewing. Because this gum is good, so the injectable, unbreakable partial, which is not expensive, they can wear it. He can wear it before he going to another implant site. Depends on the patient, their budget. Anyway, he got this top of the line, the facials aesthetic as much as possible from the New York. I wish I can get a final photo from them, the video, whatever. Anyway, that was from our success from the wax trying. trying to minimize the tissue. Actually, this is make more natural as possible, because look at this is lower teeth. Lower teeth is color we're trying to mimic, except the black dark color. See? Alright, that one is cool. Is a minimum. Pink. And this one is occlusion. So cemented. It's absolutely great, and also is very thin. See? And you can wear it before sleep. You're gonna have to wear this one all the time. Alright, so happy to make the top of the line restoration better than any other jewel. Thanks for watching.